everybody. I'm Lee Cade, and this is VINI. We're doing a follow-up to our State of the COVID address from Wednesday. Today, again, we have Valley Fit APRN Clare Eggett, and of course, our Chief Operating Officer, Becky Brown. Good morning.
Morning, Lee.
We were just going to do one segment on COVID, but I really feel like it's important that we kind of hammer home the importance of this issue right now. Becky, how are we doing as far as COVID's concerned around Valley? I know last time we talked, we weren't doing so great.
We go through these moments where we think we are doing better, and then Friday hits, and then the whole week hits. And we have seen an exponential increase that has continued in staff to staff spread. And I cannot express that enough. What we are seeing in the current trends continue to be that we do not have clients bringing illness into our staff members. We have staff who are going out and being with friends and family who is ill, friends who aren't masked, and then they're coming in. And then to impact matters more significantly, we have staff who are then either hanging out with staff members from other divisions or other units or within their unit, and then that spread continues. So we're really trying to stay ahead of that. If we don't take hold of certain areas where we're seeing the spread, we will be required by the health department to close programs. So it's so important for us to keep those cases down. We continue to provide massive amounts of PPE to our teams as they need it and as they request, but we can't make our staff wear masks either. We're monitoring for that. And I just think, this time is so critical. I heard from a colleague yesterday that she has a family member who is working in the ERs or not the ERs, the ICUs, and they're now sending adult patients who are in 30 and below to pediatric ICUs because there is such a capacity issue within our state. We are at 88% capacity for our referral ICUs, which are our big, large trauma ICUs that can actually handle the ECMO machines? ECMO machines, and that can handle what is needed to deal with those with severe COVID. And so most people have said capacity isn't really the issue as far as geographic space. We can make that happen. And ventilators, in fact, are not the issue at this point. But trained staff who know how to handle the acuity of patients that they're seeing that are very severely ill with COVID are the problem. So I think that's the scary part.
Claire, how are things affected there at Valley Fit? I know that there's not a lot of you there, right? Yeah,
I'll be honest and tell you that it is overwhelming some days when we're trying to balance doing the physicals, keeping the healthy people within the clinic, and trying to see people for other acute needs, their urinary infection, their sore throat, their other things that are maybe not COVID related, and keeping that separated and segmented from those that might be sick. We really have had a huge influx in COVID testing and in screening those people and trying to do more telemedicine things to try to keep people healthy, address our employees that have been sick. We will frequently have 5, 10, 15 COVID tests in between seeing patients. And I've got to dedicate one full MA to being able to go out and swab and be safe and geared up and be able to handle that whole thing. So it takes a whole staff member on some days to just do the COVID process on top of the other responsibilities here at the clinic. And so from that level, I feel the pressure. It takes away from our other good care that we want to give, like response times to things and being able to draw labs and interpret things and do all the things that you think your family practice clinic should be able to do. And that impacts everything from the staff availability to our ability to, even help with the dispensing of COVID PPE and things like that, which we're doing here at the clinic too. But what I wanted to add to what Becky said in regards to that is that I feel a lot of compassion for my ICU colleagues. I worked in the cardiac ICU at Intermountain Medical Center for years. And, I hear from them a lot about just their caregiver fatigue and burnout, because every day they're going to a situation where they're dealing with the sickest of the sick, and they're spending their entire day in not just PPE, but PAPRs, where they're wearing the whole helmet, mask, in negative pressure rooms, and then they're trying to keep themselves safe and mentally sound to go take care of their families too. And it's incredible. I worry about our not only having enough numbers of caregivers, but also just not burning them out, those skilled ICU nurses to where they're unable to perform their job functions or do what they need to do because of the duration of this thing and the severity of it and the sheer numbers. So I worry about my colleagues that are still in the ICU for those reasons too.
I know you're both incredibly busy, so I'm not sure if you have time to sit down at the end of the day and just absorb the constant doom cycle of news. But I'm reading that people who are in the ICU for COVID need something like 3 times the level of care that a regular person who's sick. I'm seeing that ICU employees, people working in the ICU, are working upwards of 36 hours to a shift because there's no one there to replace them or because of the rate of exhaustion. Aside from masking, what can we do to bring down the impact on our vital healthcare network?
Stay home.
Yeah.
I mean, that is really at this point, except for essential store visits, at this point, the only thing that we can do right now to save where we're headed is stay home. Not have gatherings with people outside of your household. At this point, they still have restaurants and gyms open, which I personally just can't stomach. I drive by the gym near my home and there's 100+ cars in the parking lot. I think that we have a personal social responsibility for mankind and those that we're working with, not just in physical health, but the overall impact of the continued loss and tragedy that is going to impact even our system as mental health and behavioral health providers is significant. And the more we do now to reduce the impact, the better. And so I think that it's never been more important to figure out how to do this differently for 1 year. We are, as humans, not being asked to never see our family again, unless, of course, unfortunately, something really terrible happens. But at this point, we're just being asked to take social responsibility for right now, for this holiday season, for this month. Right now, it's for a few more days, unless the orders are changed. And so I think, can I make a commitment for the people that I look at every day and the vulnerable populations that I work with to stay home? I can do that. And I think that we need to ask that and really beg for that at this point from our fellow colleagues, coworkers, leaders. It's pretty serious.
I think we touched on this before, but I do think that, making the sacrifice now will impact our ability to have our families and our loved ones be around and have more holidays together and more gatherings. And so we have to look at that sacrifice that we need to make now as a dedication to the future of our kids and our grandparents and our people that we want in our lives for a longer period of time. I'm a gym lover myself, but if I have to do my yoga class over a Zoom call, that's what I'm going to do.
One of the other unintended consequences that's coming around, my wife in revenue cycle had a hire from another department in the organization who was exposed to COVID in the last few days of her old position. So all of a sudden, here is your lateral move to another part of the company that has been completely stalled out because we have to wait until the 5 days after exposure. There's the whole getting your new equipment. There's the training on the essential operations of a completely different part of the company. Are we seeing more and more of this? Are we seeing these roadblocks that are just hitting because somebody got exposed somewhere?
I think that's a really fair statement. We are. I think one of the most important and I think not to be missed positive things about the work that Valley is doing is that I believe that we have an organization that is incredibly efficient and is monitoring and tracking and responding like nothing I've ever seen before. So, I mean, because we have the rapid testing, we do testing twice a day at the clinic. We're catching these situations more quickly. We're diligently finding them. And so that potential situation could have been so much worse, but it was caught very quickly, immediately tracking spread and doing those things. So I don't want to lose sight of the fact that I think we have a really responsive and robust response to the virus, but we are seeing limitations on our ability to admit those into some of our facilities. So we're in holding patterns at our Epic campus right now. And that puts people who desperately need care on hold somewhere in the system, whether that's in a detox or in a jail, and they want help and they need to get better and they're sick and they're ill and they're not feeling good. They're not connected with their family because of a whole other situation, which is addiction. And so we're compounding the issues that we deal with already on a daily basis that are incredibly complex and kind of adding to those. So I think that those are some of the significant impacts that I'm seeing across the system is, yes, there are barriers. There are things being put on on hold. There are people who are out of work and who are out of work with their children who have now been exposed. And all of those things are very scary. And the anxiety is taxing, I think, for the workforce, and the COVID fatigue is very taxing. So right now it's immeasurable, the impact.
And I would say too, our essential healthcare employees, if you go in an asymptomatic carrier, or if you are symptomatic and you're a person that brings it into your own unit, even if one person gets sick or whatever, you and one person are out, the impact that that has on the people that are there picking up the pieces is fatiguing and is very difficult emotionally if you know you have to go in for the next week without any help to do your job and somebody else's job. And so, I think we have to take some inventory of that, and also, think about the other people when we make those decisions to not to stay home from the gym or to not go out to eat. It's really impacting more than just you. You need to see that in your respecting your coworkers and also the clients that we serve and the patients that we serve. You're showing a lot of respect for them by making good decisions for yourself.
Now, Utah State epidemiologist Angela Dunn said yesterday that the test positivity rate is coming back. 1 in 4 tests are coming back positive. What hit me harder than that was she said that the implication there that there are a lot of people who are positive out there that aren't getting tested. Exactly what does that mean?
I think that what's happening is it's becoming so frequent that, and some people are already, say, working from home or something like that. So if they are fairly convinced that they have COVID symptoms, rather than even getting tested, they're just sort of hunkering down and staying home in some cases, which is a good thing for sure. It means that there are even more cases out there than we probably are aware of. And while that is a good thing that they're isolating themselves, sometimes what happens is maybe another person in the household or a family member isn't isolating and doesn't really have a confirmation. So they're not as diligent to stay home because they're not sick. So that definitely can be a bad thing too, not to know, because then, you're suspecting and you're trying to isolate yourself, but maybe not as diligently as you would if you had a confirmed test.
Gotcha. Anything else either one of you wanted to add before we wrap things up for today in the second part of our State of the COVID address here?
I'd say thank you to everybody who is wearing their masks and staying home, and please keep yourselves safe.
And I would echo what Claire said. And I just think we have an incredibly resilient workforce. Watching, as awful as it has been to watch through the virus and watch people going through this suffering, watching the strength within the Valley family has been, awe-inspiring.
I'm honored to work for a company that believes strongly in these things, and their actions coincide with that.
Yeah, I'm impressed every time I go into North Valley. I get to see the people at the front desk 2-3 times a week. And every day they're interacting with clients, taking care of vital face-to-face issues. And they're unwavering in their dedication to their job. So it's really awesome to see that. So Keep up the good work, everyone. Well, thanks so much, everybody. Next week, we'll be joined by Valley CEO Gary Larsonaire. And I promise, it's going to be a lot more, should we say, happy. Uplifting and happy. So we're going to have Gary will be talking with us about gratitude, and we'll have a holiday message. So stay tuned for that. Thanks so much for joining us today.